My name is Dr. Jim Westerman, and today we're going to give you a demonstration on non-surgical spinal decompression. So along with my assistant Crystal, take a bow Crystal, and our patient Dave has agreed to be the model for our demonstration today. So Crystal at this point has put the harnesses on Dave. There's one around his pelvis, and then there's another one up around the rib cage. And these are the two areas that we're going to separate in order to get the decompression effect that we want. So I'm going to have Crystal go ahead and put Dave on the machine. Now, non-surgical spinal decompression is a therapy that we use for conditions like stenosis, disc herniation, disc bulges, spondylolisthesis, and anybody that's had chronic or severe back pain who's tried many other things that haven't worked. And the idea behind decompression is that we are separating the vertebrae, at which point there's a negative pressure that's produced in the disc, and it will draw fluids and nutrients in there. So Crystal at this point is tightening up the harnesses, and the one up at the headpiece there is the one that goes up underneath the rib cage. This strap that she's putting on right now hooks into the decompression machine, and now she is going to set the machine for the amount of pull that we want, and it's dependent on a person's body weight and their level of conditioning. There's a safety switch that she's just given Dave so that if something happens he can shut off the machine and the program starts. So I'm going to ask you, Dave, a couple questions. First of all, you're about halfway through, or a little over halfway through your treatment, and tell me a little bit about what you've noticed so far.
Well, I think the biggest thing is the reduction in pain, my ability to move. I've gone, I guess, 3 years on pain medication, and after 3 weeks of decompression, I'm off all pain medication, so that's been the biggest difference.
That's a great change. As I look at you on the table, some people may think that that would be uncomfortable. What would you say to that?
Oh, it's very comfortable. There's just a slight pull on the hips. You're laying down. It's only about 20 minutes. I really don't feel any kind of pressure or anything like that. No pain in my back.
All right. Well, thank you for helping us with this video, and I hope to be able to use it to help other people that need this kind of treatment. Thank you both.